December last year, more than 30 nurses at Lay's Angau Memorial Hospital were called to retire from their jobs. After they vacated their positions, they were immediately put off from the national government's payroll. This was part of a retrenchment exercise conducted by the management of the Angau Hospital. The management of the hospital told the nurses that their retrenchment entitlements would be paid to them early this year. The nurses said their retirement claims were supposed to be paid by the National Health Department and not by the management of Angau Hospital. But earlier this week, when the nurses returned to check on their entitlements, they found out that Angau will make the payment and not the National Health Department.
Angau employed under the Department of Health, National Department of Health. So when I can expense repatriation exercise, I must come underneath the national government. Professional line here, laborers or casuals, yes. Where Angau employ so Angau will treat all same.
Almost all nurses who were called on to retire were veteran nurses who have served patients at the Angau Hospital for more than 30 years. Now what angered them is the method of payment that they will get, which will be paid to them in the form of checks. This means that they are not fully entitled to receive the benefits that a retired public servant should get.
Because payment belongs to only leukemia. The highest payout now, leukemia was 30,000. Now lowest 11,000. Everyone, casual payment, casual worker. This let me know. Look, you professional line. Only no buy also.
The management of the hospital also told the nurses that if they reject the check payments, their entitlements would take a longer time before it can be given to them.
Telling us that if you decline these checks and you appeal on that, it will take you some years.
We could not get comments from the management of the Angau Hospital in time for this broadcast, but it is understood that the nurses were registered workers employed by the National Health Department. This means that the National Health Department is responsible to pay the entitlements of the nurses and not the management of Angau Hospital. Edwin Fidelis, National EMTV News, Lay.